Okay guys, so now this is the bronch table setup portion. So this is pretty much all of the supplies that you'll need to grab to pass this part. So remember, I'm gonna have a bunch of supplies on the table, including things that you don't need, and you will have to pick from those items what you do need on this table. So to go over it all, we have either our mask or nasal cannula for if we have a non-intubated patient. And then we have a bite block for a non-intubated patient, or we have the swivel adapter for an intubated patient. So this goes in line in our ET tube. So ET tube goes on that end, your circuit goes on that end, and then this is where you stick your scope down. It comes with just this one little slit in it that's pretty tight for the scope to get down. So again, I cut this the other way just to make it a little bit easier for the doctor to get the scope in. You don't have to do that for the test though. This is just to let you know. You're gonna grab a bottle of sodium chloride. I will have different specimen cups by the time your guys' final or midterm comes. I just haven't had a chance to grab them, but you will want a specimen cup for if you take any samples. You want lidocaine gel. So if your patient is not intubated and you're going through the nose, you can put lidocaine gel up their nose to help, again, with numbing their airway. If it's an intubated patient, use endoscopic instrument lubricant. So this goes on your ET tube. You want your 4x4 gauze. So when your doctor's ready to start, again, you just either squeeze some of this on here and then you taco it around the end of your scope. Or if you're doing the ET tube one, you kind of just hold it flat and sort of, zigzag squirt it on your scope. Next, you need a couple of 20 mil slip tip syringes. So remember, those ones are not the lure lock kind. These are the slip tip. Remember, this is the lure lock kind. So you need about 2 or 3 of these. And then you also need 10 mil syringes. Again, like 2 or 3 of these. You need an emesis basin. This is what you're going to put some of your sodium chloride in. Extra needles for if you want to either, so there's 2 ways you can get the medication out of these vials. You can actually use a bottle opener. So that will be one of the items. I'm missing it today, but that will be one of the items you grab. A bottle opener, you can actually pop these off, or you can use the needle and a syringe and pull it out. So you'll grab that. And then you also grab other specimen cups for your lidocaine. It will look just like this. So we can keep these blank. I will have little post-it notes out for you guys. So you will label your post-it note and then put it on top of your specimen, your specimen cups, 1%, 2%, 4%. I don't have actual epinephrine, so this is what will be there. So just pretend that this is like an already diluted form of epinephrine that you might instill down the bronch scope in case your patient has like excessive bleeding from taking a sample. And then down here, I didn't have room for it up there. This is all the supplies that you would need in case your doctor or physician, whoever, wants to do a BAL, so a bronchial alveolar lavage. So remember, this is a somewhat sterile procedure, so we don't open up any of these supplies until we're about ready to start. But for it, you need a basin. So right before we start, we open this up and we pour an sterile, unopened, so we have to get a new one of these. So usually I have 2 of these on hand. We would pour some of that into here. We get extra Lukens traps. So these are separate samples from the first Lukens trap that we set up on our bronch. So we would take that old Lukens trap off and put these ones on. This way we know specifically what lobe and stuff we pulled that sample from. And then lastly, you will again need another 20 ml syringe for this, because when you do these, you take the full 20 mLs of sodium chloride and then instill it down your scope, and then you suck out whatever you can suck out. So you do 20 ml doses at a time, and it's just up to your doctor how much they want to instill down. So you'll need all this as well. So that plus that stuff, and including either a mask or a cannula, and then towels underneath. I always like to put towels down because we're working with mucus. And then I also put a towel down on my patient. So it just gives a field for the doctor to squirt out mucus and gross stuff. So that will be the last station.